Hi all, I'm Dr. Malathi working as a professor in Trippuram College of Nursing. So in this video, I'm going to discuss about injection Methergin. The objectives are introduction, mechanism of action, indication, dosage and administration, contraindication, side effects, nursing management, precautions, summary and conclusion. Introduction. Injection Methergin is a uterotonic drug used to prevent and control PPH. It also acts by producing strong uterine contraction after delivery. It is usually given in the route of IM or IV after childbirth as part of the active management of the third stage of labor. Nurses should monitor BP, uterine tone and bleeding as it may cause hypertension and other side effects. Generic name is methyl ergonovine maleate. Trade name is Methergin. Classification, it is an ergot derivatives uterotonic agent. So the action here is it acts as a direct stimulation of smooth muscle in the uterus. It increases the rate, tonicity as well as the amplitude of contractions. Mechanism of action. It induces rapid, sustained tetanic uterine contraction, vasoconstriction, shortens the third stage of labor and reduces the blood loss. It acts directly on the smooth muscles of the uterus. It also increases the rate, frequency and amplitude of uterine contraction. Coming on to the indication, it can be administered during active management of third stage of labor, helps to facilitate the placental delivery, PPH prevention and control of uterine atonicity, then during post-abortal hemorrhage. The dosage and administration is 0.2 milligram 1 ml ampule. Then for the IM route, it is a preferable one, 0.2 mg 1 ml administered IM after the delivery of the placenta. In IV route, 0.2 mg 1 ml administered slowly over at least 60 seconds with blood pressure monitoring. Then can be administered through oral route, 0.2 mg to 0.4 mg tablet 2 to 4 times daily during the puerperium period up to 1 week. Contraindications are hypertension, gestational hypertension, preeclampsia and eclampsia, heart disease, ischemic heart disease and coronary artery disease, hypersensitivity to ergot alkaloids, then peripheral vascular disease. In these conditions, we are not supposed to administer Methergin. And the side effects are, under the cardiovascular system, there is a chances of developing a hypertension, bradycardia or else the chest pain, gastrointestinal nausea and vomiting, neurological headache and dizziness, and generally tetanic uterine contractions. Nursing managements. Pre-administration, always the nurses should check the blood pressure. Do not give if the blood pressure is too high. Can be administered before administering the drug. Verify the dose, route and check for uterine atonicity. Then after administration, monitor for uterine tonicity by checking a fundal height. Then continuous BP has to be monitored. Then health educate the mother regarding the cramping. Precautions are, do not use for induction of labor, use with caution in renal and hepatic impairment. Summary. Injection Methergin is a uterotonic drug used in obstetric practice to prevent and control PPH. It belongs to the ergot alkaloid group and acts by producing the strong and sustained contraction of the uterine smooth muscle, thereby reducing excessive bleeding after delivery. It is usually administered 0.2 milligram IM after delivery of the placenta and may be given slowly IV in emergency situations. However, it is contraindicated in patients with hypertension, preeclampsia, eclampsia and heart disease. And the common side effects are increased blood pressure, nausea, vomiting and headache. Here the nurses should play a vital role in monitoring the blood pressure, uterine tonicity, bleeding and document the findings. If anything is abnormal, it has to be bring it to the notice of obstetrician. Conclusion. Injection Methergin is an essential life-saving drug in obstetric care. Proper administration and careful nursing monitoring helps to prevent the maternal complications and also it reduces the mortality due to PPH. Knowledge of its indication, contraindication, and side effects is vital for safe and effective nursing practice. References. Thank you.